to another episode of A Case of the Mondays. I'm your podcast host, Rameez Kaleem, founder and director of 3R Strategy and author of A Case of the Mondays, a book on pay transparency. I'm joined today by Claus Madsen, a board-level executive with extensive people and organizational development experience across both private and public sectors, particularly in the NHS. Today we'll explore the vital connection between employee engagement and patient lives in the NHS and why investing in employee well-being is crucial even in times of significant budget constraints. Welcome to the podcast, Claus.
Thank you, Rameez. Nice to be here.
So let's get straight into employee engagement, which is, I know, is something that you're quite passionate about, and you believe in employee engagement surveys and how they can positively influence employees. And I guess that's even more important in the NHS. So could you tell us a bit about this and why you believe so strongly in employee engagement surveys?
Yeah, so first of all, engaging with the workforce is absolutely critical in any organization of any size. You want to understand how people feel at work. Are they thriving? Because that has a massive impact on their performance and their productivity. Do they find the work is meaningful and that they're making a positive difference? And that's really important to all of us. So it's really important for managers to engage with their direct reports and understand what it feels like to work in an organization. Now, if you're a very small organization, you might be able to just do that by reaching out to people every now and then. However, when you do a survey, anonymous survey, you might get people come forward with things that they wouldn't come forward with in a one-to-one conversation. So that's one of the reasons why it's important to also do surveys. And then in very large organizations, so we employ more than 7,000 staff in my organization. And whilst I would love to go out and talk to every single member of staff, that's very unrealistic that I'll be able to do that. I do go out and about and visit our services and speak to staff, and I absolutely love that and would never stop doing that. But in order for us to get input from as many staff as possible, that's where the staff survey comes in. So in the NHS, it's an annual staff survey, and then there are 3 quarterly pulse checks, which ask some of the key questions on a quarterly basis. But the annual staff survey is sort of the real sort of big effort across the whole of the NHS. And it is actually the largest perception study in the world. And it is also the most researched perception study in the world. So there's some really interesting links that researchers at the King's College have found out in terms of when staff are more engaged, feel more motivated at work, feel better supported by their managers and things like that, then they will obviously better advocate the organization, and that has a positive impact on recruitment and retention and things like that. But the really interesting link as well is how staff engagement, which is so in the staff survey in the NHS, there are 9 sort of categories that all the questions come under.
Okay.
And one of those categories is just called staff engagement. It's how well staff feel engaged and motivated, and etc. The level of advocacy. And what the researchers found out is the direct link between staff engagement and patient outcomes. So it's been really well researched that there is that strong link. So you improve staff engagement, you will improve the patient experience and the patient outcome. And it kind of makes sense. But one of the things that really struck me a few years ago when the researchers created a direct link between patient mortality and staff engagement, where if you move from average to good in your staff engagement score, and in the NHS, the score is on a 1 to 10 scale. So basically, average is sort of the area from probably 5 to 7, And once you move above 7, you're into the good sort of bracket. And what they found was that when you move from average to good, you reduce patient mortality by 5%. And that's
Wow.
why I always say, staff engagement can save lives. So it's hugely, you know, impactful with those kind of research outcomes. So you should be engaging staff for all the right reasons, but also it has that massive impact on the quality of performance in the organization. And we know it if you think about yourself in work. If you're not feeling supported, you're not feeling engaged, your energy levels won't be as high as if you feel motivated and engaged and supported, which means you might not be quite as productive. The quality of your delivery, whether that's quality of care in the NHS or quality in whatever job you're doing, it's likely to not be quite as high as it would be if you were highly motivated and energized and felt fully supported. So it's not like a revelation. It just makes sense that there is that connection, but it has a really strong impact when you see it sort of in a research findings that there is that clear impact. So yeah, the other element that I know we talked about previously is the well-being of staff. So obviously, in the NHS staff survey, well-being is one of the 9 categories, and there is a link between how engaged you feel and your level of well-being. But well-being in an organisation, in a lot of organisations, including in the NHS, we often think about well-being as people are off sick. How can we bring sickness absence down?
Yeah.
Because it's also costing a lot of money and it's difficult to manage with too many people off sick. But in reality, you need to move in earlier and say, how can we stop people from becoming ill in the first place? Now, as an employer, you can't reduce your sickness absence down to 0. That would be absolutely naive to think that you can. But being more proactive in the well-being space, you can definitely reduce some of the sickness absence, whether it's related to some physical conditions or whether it's related to people's mental well-being as well.
Okay. I mean, that's such a powerful study because we always hear about employee engagement surveys, and I've seen research where it talks about how employee engagement surveys can lead to higher profitability. It can lead to an increase in revenue, but we've never really seen it from this perspective where you're actually talking about better patient outcomes, even the percentage change in mortality. So is this something that has a lot of support from your senior leadership team? Because I'm guessing these are some of the metrics that they will be, I don't know, targeted on, or they'll be very interested in.
So I can't speak for the whole of the NHS, but I can speak for my organisation, which is Greater Manchester Mental Health NHS Foundation Trust. And, we, as I know many of my colleagues across the NHS, were very focused on improving staff engagement and indeed improving all of the areas of the staff survey. It's not the staff survey in itself that makes the difference. It's obviously how do people feel about working in the workplace, and we need to improve the metrics around that because it has that direct impact on the quality of care. We've got loads of work streams in place to try and improve this. I'm not going to lie, as an organisation, we are not scoring favourably across our benchmarking group, but we're on a really good journey to improving all of that. So the last staff survey, national one that we had, we improved in all of the 9 themes or the 9 categories of the staff survey, and we had a really nice letter of commendation and recognition from the national team because we had improved in everything basically. So we're expecting to continue that journey of improving, and it very much has the full support of our board. We've just launched a new people strategy where it's quite evident in there what it is we're trying to achieve and the initiatives we'll put in place to try and get there. I think most people think of the staff survey as a tool to understand, what can we do to make it the workplace better for staff. And it is absolutely a great tool because it'll give you the information you need to address things. But it is also that, performance measure that actually links directly. So like you said, there are lots of studies around how it improves your bottom line, your productivity, etc., in various sectors. But that is true in the NHS as well, with the added benefit of improving the quality of care, and through that the quality of people's lives. So it's absolutely critical.
Okay. And I think, if I think about this from an employee's perspective, one of the things that sometimes frustrates employees is they get asked all these questions and opinions in a survey, and then they feel like there's no action being taken, and it can almost be counterproductive. So how do you ensure, do you look at any data to see whether there's been an impact or what action is put in place from the surveys? And can you also talk about some of the other categories? Because you mentioned 9 categories and well-being is one of them. What are some of the other categories that are in that survey?
Yeah, so if I take your first question there, Rameez, in terms of, people provide some feedback and what happens. So what we're doing in my organisation, and I know a lot of other NHS organisations are following a similar approach, is what we call, so we call it "You Said, Together We Did, and We're Still Doing." So we've got like 3 different categories of things. So every time we do something as a result of feedback from staff, and it's not just from the staff survey, it can be from other feedback routes, and including when we do larger sort of consultation or stakeholder groups and asking people about what we can do better. So when we communicate some of the things that we do, we remind people, this is what you told us, this is what we are doing with you. So that's why we call it Together We Did. And then if we're still working on something that's in the pipeline and it's coming, we have that sort of, and we're still doing. And we, in a lot of organizations, and I've been guilty of this in the past as well, you kind of forget about that until the next survey comes around, and then you frantically run around and say, okay, well, can we share some examples? You share lots of examples with people just before the next survey, and they're like, oh, here we go again. So what we're trying to do is to do it across the year. So at least once a month, we'll share something that we've done as a result of feedback from staff. And then when we get to the next survey period, which in the NHS is October, November time, we'll then do a bit of a reminder, sort of a roadmap that says, do you remember we've already told you these are all the different things that we've done? And the purpose of that is to say, you need to have your say. You need to respond to the staff survey because it actually does make a difference. We do listen to what you're saying. Because I get it, if people feel we've told you this already and nothing ever happened, even if something did happen but the organisation forgot to communicate about it, then people might have a perception that nothing happens anyway, so why should I spend my valuable time filling in a survey? But if as a member of staff you feel, okay, something actually did happen here because me and other colleagues were sort of given our view on what we felt about something, then that will obviously drive the response percentage up. And with all surveys, you're never going to get 100%. That's an
Mm.
unrealistic aspiration. Our aspiration is that we get more than 50%. Now, we didn't get that last year. As I said, we're on a journey, so we have improved our uptake, but we've also only just sort of since last year started these recent communications about what we're actually doing. So I'm quite confident that we will have a further increase in the uptake for the response rate. Your other question about the other categories, I mean, there are, as I said, 9 different categories. So 2 of
Mm.
them are the engagement score, staff engagement, and the other one is morale. They sit sort of separately, and they were part of the old uh, staff survey structure that the NHS had. A couple of years ago, the national team introduced something they called the People Promise. So the People Promise have got 7 different promises within it. I'm not going to go through all of them, but one of
Mm.
them is we are safe and healthy. Another one is we are compassionate and inclusive. So for each of those promises, there are a number of questions underneath that staff can respond to, and you'll then get a score that says, so on a scale from 1 to 10, how well are you doing in this area? And when we get those scores, and obviously people can fill in comments as well, so we get lots of free text narrative alongside
Mm.
it. It'll give us an indication of, are we improving here with the things that we've put in place? Uh, and if we aren't improving, do we need to do something different? Um, so yeah, it's a really good instrument to give that sense of your your journey and how well you're doing. In lots of industries, when you get your staff survey, you'll get like a sector comparison, a
Yeah.
benchmark. In the NHS, we just get it from within the NHS, but the NHS is a very big. I think it's around 1.6 million staff
Mm.
currently. Um, and then there's within that is 300 and something organisations. But then, so we're a mental health trust. So across the country, there are 50 mental health trusts. So the benchmarking report we get is how do we compare to ourselves last year, and how do we compare to the benchmarking group of the other 49 mental health trusts?
Mm.
And also we can see how do we compare to the overall average of the NHS. So that's really helpful to just sort of monitor how you're progressing.
Yeah.
What we also do with the sort of the you said together we did approach is we make sure that within our, we call them care groups, so they're like business units or divisions within the organization, as well as in smaller sort of services, that the managers there have that approach as well. So they listen, because obviously when you're a big organization, you might have a group of staff in one area that feel X is a problem, and in another area that's not the problem, it's Y that's a problem.
Mm.
So the more local sort of leadership need to also own to, really understand what has staff in my area told that isn't quite where it needs to be, and how can I work on improving that. And then they use that same you said together we did, and we're still doing, approach of communicating back to staff what they've done. So we've got some, as an organization, we've got some people and OD business partners that will work with the more local management teams to help them do this in a good way.
Okay. There's something you mentioned earlier, which is really interesting around how if we don't communicate what we're doing with these surveys, that there's a perception. Um, and it reminded me of something that I always talk about because, we focus around pay and reward, and the research shows that the perception of fairness is more important than what we pay people. So even if we treat people in a fair and a consistent way, if their perception is that it's not fair, then actually we're not benefiting from any of the work that we're doing. So is pay a question that is included in your engagement survey? Because I'm just curious with, you know, with the unions involved and industrial
It is.
action?
Yeah,
Is
it
this
is. So
something you ask about?
one of those 7 people promises is called "We are recognized and rewarded," and as part of that, there is a section around pay and whether you feel that your pay
Mm.
is fair and appropriate. It's typically an area that all organizations score
Yeah.
low on because everybody would like more pay. But the way you can then sort of benchmark is to look at are you scoring favorably compared to others in your sector, or are you sort of at the bottom of that? So you need to look at it. Now, the difficulty in the NHS and I believe in most public sector organizations is that pay is not something that an individual can sort of negotiate.
Mm.
We've got pay bands, and so you start in a particular role. This is your start salary. It's the same for everybody else that starts in that type of role. Then after a couple of years, you move to this salary, a couple of years more to this, and the pay awards, which is like an annual increase, is something that there is a national pay review body that makes a recommendation to the government, and the
Mm.
government make a decision, and then everybody who's on in the NHS, it's called Agenda for Change terms and
Yeah.
conditions. They will then all get that percentage uplift. So obviously, when people respond to pay, and if they don't believe they're being paid enough, there isn't really much we could do as individual organisations, which is why sometimes the unions ballot for strike action so that they can send a strong message to the government about wanting a higher increase in pay. And we saw this in recent years a few times. So
But have you seen, for example, because when we talk about perception of fairness being more important than what we pay people, and if you can't really do something around what people are paid, have you ever done any sort of communications around pay and reward that you feel, because that in a way could also, I guess, impact positively how people feel about how they're rewarded, simply because the perception has been created that this is all fair, even if you feel like you could be paid more.
so there are other sort of subcategories to the we are uh, recognized and rewarded, and some of it is about do you feel that the organization is valuing your work? Is your do you feel that your line manager is valuing your work? So and there are other questions in some of the other categories that are more sort of to do with whether you believe your work is having a positive impact on patients. And typically, people that are in a direct patient-facing roles, so nurses and healthcare assistants, they score high on that because they can see directly the work that they do with the patients has got a positive impact.
Hmm.
Whereas people in my team, in the people directorate, as well as in finance or cleaners, they typically score a lot lower on that because even though we try to tell them what you do is really important in supporting our frontline colleagues
Yeah.
who then support the patients directly, the individual member of staff might not see that. So we try as best we can to create some of those links for those staff as well. In one of my previous roles, we had some cleaners that scored very low on that, but we had a particular project with a group of cleaners. So this is when I worked in the ambulance sector. So this is a few
Hmm.
years ago, where the paramedics used to clean the ambulances, and we changed it to have a team of specialist cleaners to clean the ambulances and restock, etc. And actually, we saw some performance improvement in terms of cross contamination and other things that basically just evidence that when the ambulances are better cleaned, it's better for patient care, which makes sense. But
Hmm.
then we could present that result directly to the cleaners, and they could take pride in really having made a positive difference there. So um, sometimes it's not so easy to create that direct link. But what I will say is, especially in an organization where pay is almost non-negotiable, um, as well as if you're in the voluntary sector, if you can make sure that people feel recognized and rewarded in other ways, and that what they do is meaningful, that'll be why they come to work. I mean, in the voluntary sector, it's really easy because people just vote with their feet. If they don't like it, they can walk away. If
Yeah.
you're in a paid job, you probably need that income to keep your life going, and you're not going to vote with your feet, but then you might be voting in other ways. So it is really important, and even if people can negotiate their pay, we know that pay isn't everything. It's important, but there are other things. So people want to have a meaningful job. They want to be able to make a difference, and so sometimes that can be even more important than pay. One of the things that we know from exit data, so we do exit questionnaires with people that leave the organization, and that has also informed our people strategy. So two of the biggest issues that have been raised through that is a lack of career progression opportunities. So we're working really hard to create some better opportunities there, but then also people's own well-being, which really makes me sad to think that people are leaving because they feel that the job they're doing is not good for their well-being. So as an organization, we really need to take that seriously and focus on how can we make sure that people are well in work. So that's a key priority in our new people strategy. There is some really interesting research. I think I'll just mention that now as well. So in Singapore, earlier this year, a white paper was released from a group of researchers that had looked into, so what are the well-being initiatives that actually directly impacts on an organization's performance. So they didn't look into healthcare, but I'm sure there is some transferability, but they looked across loads and loads of different sectors. And what they found was that the number one initiative that has the highest impact on an organization's productivity and performance is leaders' well-being. So often we put in place all these sticking plasters of, let's put in a stress management course, let's do something here, let's do something there, a bit of yoga, a bit of, all kinds of things that we come up with. They all make a positive difference, but when you look at it proportionately, they only make a tiny difference compared to if you really want to make a difference on productivity and performance in your organization, you need to focus on your leaders' well-being. Now, that's not the reason for that is not that it's just about how well your leaders are, but if your leaders' well-being, but from the very top and further down, if your leaders feel more well and they thrive, then they've obviously got the excess capacity, energy, and motivation to make sure that other people are well at work as well. So if the leaders are too stressed, that'll have a ripple effect. So to their direct reports, and a further ripple effect to the next line with negativity and adding to the stress in the workforce. So what I'm saying and what the research is saying is not that stop doing everything else you do to support the well-being of your staff and only focus on your leaders, because obviously that would be madness. But it is to really hone in on what can we do for our leaders to make sure that they are well at work, because it has such a huge impact on the rest of the workforce.
Yeah, I mean, I guess it's about role modeling and prioritizing as well, isn't it? Because if the employees see that the leaders are prioritizing their well-being, they're, for example, taking a mental health day, that they feel like actually it's okay for me to do this as well. Otherwise, they might actually be worried about doing something because they haven't seen any of their leaders do this.
Absolutely. And also, I mean, sometimes, and we're probably all guilty of this, we're not necessarily role modeling the best well-being approach for ourselves. But if we don't build in into our daily work to look after ourselves, whether that's physically, mentally, in various ways, um, then what are the messages that we're sending to everybody else? So if as a leader you're sending emails at 3 a.m. at night, I mean, if you're on a night shift, it's different. It's obviously okay, but if you work 9 to 5, but then you send an email at 3 a.m. or you send a request to some of your staff on a Saturday afternoon, now that you might not intend for people to then read it and act on it then and there, but some staff might feel, oh, I have to respond to this now, and it's Saturday afternoon or 3 a.m. at night if they see it for whatever reason, if they weren't asleep. So if as a leader you need to send something, let's say out of normal hours, what you can do is just put a disclaimer in your email that says, I'm sending this out of hours because that suits me and my well-being, etc. I'm not expecting you to respond until you're back in work. Something like that, and just being mindful about whatever you do as a leader, whether you're an executive or whether you're a team leader, whatever you do will be looked at by your colleagues, and they will think that that's okay, that's the way we're doing things here. So you are contributing to the culture in the organization. So if you can think about how to role model from a well-being perspective, then that'll have a positive ripple effect in the organization as well.
Yeah, I have to admit I'm guilty of sending those 2, 3 a.m. emails. And one thing I do now is I always do the delayed send. So I schedule it to go out at 9 a.m. even though I'm pressing send now. So
Yeah, Outlook
that's
is
another.
clever like that, isn't it? So
Yeah.
so it's about using technology as well, if that's relevant. And I've been guilty of it myself, sending things on a Sunday afternoon, not thinking that, and then getting a response from a member of staff thinking, no, I didn't expect you to respond now. But so yeah, it's so using that functionality in Outlook might be a really good idea to implement. Absolutely.
So thanks, Klaus, for all of your insights and tips. I really like the example you gave earlier around the cleaners and linking it back to the patient outcomes. And, it's because it really creates that sense of purpose amongst employees where they don't naturally see it. If somebody wants to get in touch with you or connect with you, what is the best way for them to do that?
Well, the best way is probably just to reach out to our organisations if they go online. That there are contact details on there, and I'll be happy to get back to people. So that's fine.
Great. And before you go, so on a lighter note, a question I always ask my guests is, can you tell me what your favorite film is and why?
Yeah, thanks, Rameez. I actually love good films, and there are many good films. But if I were to just pick one, I would say The Matrix, the
Okay.
original, the first one. And I mean, apart from being a fantastic film at the time when it came out, it was just sort of breaking boundaries in many different ways. But it still is a fantastic film, and I think the scene I love the most is when Morpheus gives Neo the
Two pills.
option between the two different pills.
Yeah.
You can live your life and just go on, not knowing what's happening behind the scene kind of thing, or you can take this one. It might take you down a rabbit hole, but it'll open your eyes. You'll see things in a very different way. I can't remember exactly what he said, but that's that kind of notion, and that's for me a brilliant film, and the analogy of sometimes you have to make that choice. Once you open up and you get insight into something, you can't really unsee it again. You can't rollback.
Yeah.
You have to then do something about it if it's a problem that needs fixing.
Great, thanks. It's yeah, a great film, and I'm also really into film, so this is one of my favorite parts of the podcast. So, and often when I hear about favorite films, I often think, oh, I should watch that one again. It's been like 15 years since I've seen that, so I think one I'll probably watch again. So thanks again, Klaus. Thanks everyone for listening, and we'll speak to you again on our next episode of A Case of the Mondays.
Well, thank you for having me.
Enjoy this episode? Join the Academy for free and have access to CPD certified reward training, quarterly reward community sessions, first access to salary insights reports, reward and benefits market data, and hundreds of free practical tools and templates.